Dr. Fahmi Farah joins us here on the KRLD Afternoon News. Fahmi, we talk about the risks of cold weather, travel, and everything, but there's also a risk to our heart health. What is it about the holidays that makes it so possibly dangerous for heart patients?
Yeah, this time of the year, we tend to see a sharp rise in hospitalization with heart conditions like heart attack, heart failure. It's actually more than one reason. During this time of the year, people typically tend to eat a little bit unhealthy. Food has a lot more fat and salt, and so that tends to push a lot of people over the edge. Blood pressure gets high cholesterol. And the high salt is actually really important, especially for people who have pre-existing conditions called heart failure. Those with congestive heart failure, that added salt can really push them over the edge, and they can start getting fluid built up in their lungs and their legs, and they can start having shortness of breath. So during this time of the year, we see a lot of people just showing up swollen and just can't breathe because they're having their heart failure flare up. But it's more than just food. It's healthy habits. They kind of go away during this time of the year. People get tired. They travel, so compliance goes down. They're not taking their medications as they're supposed to. Alcohol intake goes up, and then stress generally is higher with all the financial burden, having to buy gifts. So it's more than one reason.
So is there a shock to the system because of the last month or so of we've just changed our diets to start eating unhealthy?
It is to some degree, yeah, because as I was saying, salt is a very good example of that, something your body's just not that used to, and suddenly you're giving it a lot more sodium, and so your heart and your entire body just doesn't know how to deal with that. Same thing with stress, like when you're having a lot of stress and you're just not taking care of yourself, you're off of your routine. A lot of people don't exercise during this time of the year. And so it's just all those things kind of take a toll on your body. I do want to mention one other thing. One of the reasons why we see an uptick in heart attack during this time of the year is the cold weather itself. In areas where it gets very cold and it snows, there's something with snow shoveling. People who go out there and they have to shovel snow, a lot of times they get a heart attack as a result of that. And these are the same people who are not used to that kind of activity. Shoveling snow is a lot of work. It increases the stress on the heart, and that's a sudden increase in activity. And so a lot of times people who have pre-existing, risk factors like high blood pressure, diabetes, they don't know they have heart disease, but they'll suddenly have a heart attack as a result of that. So it's a lot of factors that go into this.
I was going to ask you about the cold weather. We've been experiencing cold weather here in North Texas for the first time in a couple of years now. Can that cold also be a shock to the system, and kind of talk about these shocks to the system? Is the cold part of that too?
It certainly could be anything that's that we're not used to. Anything that puts stress on the body can push us over the edge, particularly for those who have risk factors like diabetes, high blood pressure, smokers, and people who have really high family history from a hereditary standpoint. They can all get affected.
We also you talked about stress and how stress can be a major factor in heart disease. There is an awful lot of stress as well in seeing relatives you might not have seen for an entire year, and there might be a reason why you haven't seen those relatives for an entire year. What kind of stress does that put on you?
I can see how that could be stressful. Yes, there are some people who, a lot of family members, they avoid for a reason. They just have that negative energy in them, and being around them can stress people out. I've heard it from a lot of my patients. So yeah, getting into family arguments during the holiday season, I think that's fairly common among a lot of people. So I think stress is a big deal during this time of the year.
As we head towards the new year as well, do you also see these higher risk factors for heart disease also extending into New Year's Eve, New Year's Day, and then in the days past?
We do. We really see it from the time of Thanksgiving all the way until after New Year's, because this entire time people are not necessarily following their routine, and they're deviating. And alcohol is a big deal, especially on New Year's Eve. A lot of alcohol consumption can cause somebody to go into heart failure. And so alcohol has a pretty detrimental effect all over your body, and the heart is one of those organs that it affects pretty profoundly.
A lot of people don't necessarily associate alcohol intake with heart issues. This has always been the case, hasn't it? And there are always these studies that show that things like red wine are actually good for your heart. Is what is
That's right.
is it a case of excess?
No, actually, before we used to say that, one drink of alcohol is okay. We don't say that anymore because a couple of years ago we had a very large scale study done. It was an international study that studied thousands of people. It was a study done on effects of alcohol, and it proved that no amount of alcohol is good for our body. So we cannot say that alcohol has any beneficial effect, even for red wine. The benefit, I mean, the risk outweighs the benefit.
When do risks for heart disease tend to slow down after the new year?
Typically, a couple of weeks after the New Year's, it really is a sharp decline after New Year's. It's usually like a 3 to 4 week span, starting from Thanksgiving all the way until New Year's.
We talk about the various factors around the holidays with heart risk factors, and it even starts, I'm wondering, before Thanksgiving as we change the clocks and the end of daylight saving time, and does that start a little snowball effect?
It very well could be. I gave several interviews this year on that topic because there were some studies that have shown that daylight saving, time saving, it does have some impact on our heart health, overall health in general, also heart health, just because, it affects our circadian rhythm to some degree. And our circadian rhythm is our sleep pattern. So in some people, especially those who are really sensitive, who already have sleep disturbance, that 1 hour can really throw them off their schedule. And then they have issues with sleeping, and sleep is a risk factor for heart disease. So good night's sleep is very important for our heart health. And people just get stressed out, even though it's a 1 hour change, but that change, it's a change nonetheless. And we don't usually like change.